I'm Dr. Jay Hitson with LT360 Health Center. One of the exciting things that we've been working on is our Regenerative Medicine program. Now, the reason why we have adopted a Regenerative Medicine program is because it fits perfectly into LT360's mission and purpose and just our passion. One of the key things that we have been looking at is how this nation is spending 17% of our GDP, 17% of our gross domestic product on preventable and reversible conditions, one of those being arthritis. Now, when we're looking at reversing arthritis, it's not a simple process. And when we found regenerative medicine, it was an answer to a key area that we were looking for restoration. We were looking for what can we do when a joint has been so severely damaged from either injury or just years and years and years of wear and tear. What can we do? Because there's there's stretching, there's exercises, there's a lot of different factors, but how can we prevent more drugs? How can we prevent more surgeries? Because yes, there is a place for surgery, absolutely. But every time you go in and you cut on the human body, there's always scar tissue. There's always other effects that come from that. And frankly, there are risk factors to surgeries, and the success rate isn't as high as we would like it to be, especially on the spine and some of the other joints of the body. With regenerative medicine, what we're able to do is we're actually able to reverse some of the effects of deterioration, degeneration, and arthritis. So for instance, whenever you have like a knee, for instance, and I've got an example of one right here. So with regards to the knee, there is where the bones come up and meet, and then there are various cartilage layers that are going between. And what has happened in a lot of different individuals is they have worn down this cartilage to where there's no more cushion in the middle. It's just bone on bone. And up till now, there's been very little that can be done with that except for, injections so you don't feel it, to just mask the pain. Those are a lot of steroid type injections, cortisone injections, that type of thing. They will go through and do physical therapy, and a lot of you have probably already tried that, which does just help with all of the other balancing out the tissues and whatnot. But again, it can't restore bone on bone, or it's just basically surgeries. Surgeries where they go in and either they clean it out, scope it out, or they replace the whole thing in general. And the problem with that is not only, there's different risk factors, and there's a lot of downtime. If you go in and replace this entire joint, now there's a whole process of rehabilitation, there's a whole process of physical therapy, and there's a lot of downtime. And now you also have to have other individuals come in and help you as you're rehabilitating, and that's not always an option. So what we're able to do with regenerative medicine, now we have several different types of regenerative medicine, and honestly, by the time this video goes out, we'll probably have found more different types of regenerative medicine. But we have several different ones. Speaking of knees specifically, there's a particular amnio product that we're able to go in, and we're actually able to inject into this area a product that helps the body rebuild cartilage. Yes, rebuild cartilage. Here's the interesting thing. After about the age of 20, 25, the cartilage you have, the cartilage you have left at that point is the cartilage you have to make last the rest of your lifetime. Your body stops making cartilage after about 20 to 25. So if you are now 70, 75, and you've worn this away pretty good, this is a really, really good option before trying some invasive surgeries and other procedures. There is also different Hymovis type of injections, and for those of you who aren't all the way bone on bone, but you just need a little bit more help, it's kind of like the oil can to the Tin Man. It just makes it not quite so squeaky, kind of like my knee right here. It's just a little bit squeaky right now, and it just gives that more fluidity as you move. When we have several other different products specifically for knees, shoulders, hips, feet, hands. That's been a really big one. We've been able to help a lot of people who have some tremendous problems in their hands, and it's been very, very exciting. Very, very little downtime, almost no risks, almost no side effects, and if you have Medicare, it's paid at 100%, which is really incredible. Now we actually have some of the commercial payers like Blue Cross Blue Shield, Cigna, Aetna, etc., that also are now sponsoring different products that we can use on this as well, and they are footing the bill on that. So it's been really exciting. This technology is not new. This has actually been around for quite a while. A lot of you have heard of referred to as stem cell technology. The problem with stem cell up to this point is it's extremely expensive. And the average person really just couldn't afford enough of these injections to get really great results. I mean, it would cost $10,000 just for one knee, and they may still require more. So it has been wonderful to have, and right here at the LT360 Health Center, we're one of the few clinics in this region and really around the nation that has the credentialing and authorization to do these injections and get them reimbursed by insurance. It's very, very exciting. Now, one of the other factors is with regards to the spine, because especially a lot of you have been diagnosed with degenerative joint disease. You've been told you have arthritis in the spine. You have chronic and constant low back pain, neck pain, and a lot of other just different factors. And one of the problems that we've had historically, whenever the spine starts to deteriorate and you start to have all of these different spurs, the discs have worn away, and you're starting to get to where it's a bone on bone situation. Again, these regenerative medicine programs and products have been amazing, where we can actually inject in the product and get the body rebuilding these tissues and actually recreating some of that lost space and some of that joint tissue. We're able to get people a whole lot of relief. Now, most of our patients tell us, that it typically makes them feel about 5 to 10 years younger. And you know what? Sometimes that's just enough to get them back to doing the things that they love, being able to get them back to their lives. And our major objective is to be able to get people some of that range, some of that mobility, some of that flexibility back, so then they can start exercising, they can start walking again, they can start doing some of those other things to maybe then reduce some of their weight or to reduce some of the other factors that got them there in the first place. It's really giving a lot of people a second chance. So here's one of the factors is not everybody's a candidate for these particular types of procedures, but what I would encourage anybody who is considering something like this is to give us a call and to get evaluated, to find out where you are at, because the sooner we can catch this, the better your results are going to be. And frankly, our LT360 community has been getting cartilage. So being healthy at the cellular level just enhances this whole process. So come in, get evaluated, let us check you out, let's see what we can get you authorized for, and see if we can get you some results, get you some relief, and get you some restoration. I'm Dr. Jay Hitson with LT360 Health Center.